My name is Benjamin Reiser, and I've been a patient at the Ear Institute for 10 years. I was born with severe, profound bilateral sensorineural hearing loss, and I was diagnosed with my hearing loss when I was 3 months old, and believe I was the first infant worldwide to use digitally programmable hearing aids. While my hearing impairment has impacted me throughout most of my life, I'm grateful to have been working with family members and audiologists that have made my hearing impairment not stand out so much in the forefront of my life. One of the best things they ever did for me in terms of my hearing impairment was maintaining a close relationship with my audiologist throughout the years and being a tremendous advocate for making sure I have the most up-to-date technology, being really aggressive on that front, especially because hearing technology is in such an exciting stage right now. We're obviously nowhere near as great as it could possibly be. There's advancements being made every year, so just being a support system for a child with a hearing impairment like me makes the process so much easier when you have somebody who's constantly advocating for better technology and always looking for what the next frontier is and seeing where the technology is going in the future. So when I was diagnosed with my hearing impairment, reading and writing were expected to be some of the skills that I would have the hardest time acquiring. But ironically, as I was growing up, they became my strongest assets. It was a matter of being proactive and constantly working to practice my speech sounds that have led me to the point where most people can't recognize that I was born deaf because of the speech skills that I've acquired. Law school was the first moment when I started to have interference between the classroom microphone that the professor was wearing and the very small FM microphone that the professors wear that amplifies speech to my hearing aid. And for the first time, when the wires were crossing, it was producing an interference and emitting this terrible noise throughout the classroom that was totally distracting. And so the first thing I did was come to the Ear Institute and try to seek relief for this issue that was affecting not only me, but other students in the classroom. And they were tremendously helpful in terms of working with Phonak and physically getting people into the classroom. Since then, we've been able to work around the issue and find a solution that works for me, so I'm still getting the speech amplified directly to my ear while also preventing feedback in the classroom system. And that would have been a much trickier process without the Ear Institute coming in and actually working to diagnose and troubleshoot the issue at hand. I'm a big Broadway fan personally, and I saw the Broadway revival of Spring Awakening, which starred Marlee Matlin, and seeing her signing on stage and working with a hearing impairment on a stage that I've grown to love so much was definitely an inspiring moment for me to realize how much work it takes for deaf and hard of hearing people such as myself to work to that mainstream level where we can be recognized on something like a commercial Broadway stage.